Well, welcome again to the next series of Nurse Digest. And today we're talking about electronic prescriptions, helping you to help your patients to understand. My name's Margaret Dempsey, and today I'm joined by Nicola Graham from the Australian Digital Health Agency. So welcome, Nikki. I'd like to acknowledge the traditional custodians on the lands across which we meet and pay my respects to their elders past, present and emerging. And I'm speaking to you from Wathaurong country today. A reminder that a recording of this session will be made available in the coming days after today's session. So welcome to you, Nikki.
Thanks so much, Marg, and thanks again, everyone, for having me. All right, so today we're just going to go through what are electronic prescriptions and how that relates to your patients. I'm going to have a bit of a look at the active script list overview, which is a new view that's going to be available. So we'll go how they work, what they are, why use them, and then who administers them, and a bit more information about that. And we'll even have some question time at the end. So let's start now. What are electronic prescriptions? They are an option for prescribers and their patients to use an electronic prescription as an alternative to that traditional paper prescription. Now, previously, only a paper prescription signed by the prescriber was the legal form by which that medicine could be supplied. So legislation now is in place to recognise an electronic prescription as that legal alternative to paper. Now, patients and prescribers will be able to choose between a paper or an electronic prescription. And it's really important to note, it is not mandatory. So a patient has the choice to be able to still have that paper prescription. And I will talk a bit more about that later, but if you've got an electronic prescription, you can't change your mind halfway through and then have a paper prescription. You have to make that choice at the start. So likewise, if you've got a paper prescription and you'd like to have an electronic one, you cannot change your mind. So it's one or the other. So let's talk now about the token, and this is what's currently available. So how it works is when the doctor issues the electronic prescription, they receive the patient, they provide the patient with a token, and that contains a unique QR code that you can sort of see on the screen here. And that's for every medicine. So if they have 3 types of medicines, Seropax, Betaloc and Digesic, for example, I'm not a clinician, so that's not probably good examples, they will receive a token for each one of those medicines, all right? And then that is then sent to the patient's mobile device. Now, again, patients can choose to receive that token either via SMS or they can even choose to receive via email. And then they have options of managing multiple tokens via an app. Now, as I was saying, a token is an evidence of a prescription and it's not the legal document. The token is really just the key the pharmacy uses to access that from the prescription delivery service. And that is where the legal content of the prescription is actually contained. So here on this screenshot, you can see the first one on the left is what it looks like when a patient receives an SMS, for example. So they would then click on the message and then they'll see that second screenshot here. And it just says tap to view your prescription. Once they tap and view the prescription, they'll then see either one of these is ERX and one is MediSecure. They're the only 2 PDS prescription delivery service providers in Australia. But they may look a little bit different, but here you can see there is the name of the medication on each one of them. There's also some identifiers, as in it's got the initials for the patient. So that's the only part there. They've also got on here how many supplies are available, the date of the prescription, so you can see some of the synergies across the both of them, and then obviously the QR code itself. Now, I mentioned before, they can also have an email sent. So this is what it would look like if they were to receive the electronic prescription via email. Now, this one here, again, there's a link within the email to select. So they could click on this link and then it'll be opened up to this paper copy here. And it, once again, provides similar details and the QR code. So I guess this is really good if the patient wants to, or the pharmacy can store it as this prescription printed out. And also then it's good for the patient if they would like to keep that paper copy as well. But note that it's done on a plain piece of paper. So now, what about if the token's expired or has been dispensed or there's something been cancelled? So when a prescription has been cancelled, it makes that token invalid. Okay, so here we can see this one has been expired. So this prescription expired. So it's no different than before. The pharmacy would check the prescription date and see that it was expired. In this instance, you can see there is no QR code. So there's nothing to scan as the prescription has expired. Here you can see this prescription's already been dispensed. We recently had someone come and mention to us that the patient took a screen capture of the token. So they'd taken the token already to be dispensed, so the prescription had been dispensed. When they took the screenshot, they thought they'd be able to get that again. So they had the screenshot there. The pharmacy scanned the QR code and it came up with, this prescription has already been dispensed. The patient then said, oh no, that's not right. But we just said, then go back to the GP. So it's really great to know that regardless of if they've taken screen captures or if it's a printed version, once it has been dispensed, that QR code is then no longer available in any circumstance. And then over here, you can see when the prescription's been ceased by the prescriber. So there are instances where the prescription may have been then ceased by that prescriber, and it then just makes that QR code then invalid. And so when the pharmacy then scans that code, they'll get that message. Now, a patient can either receive an SMS or email, as we've just said, and that's that first screenshot here, or the carer or an agent can receive on behalf of the patient. So they can receive it on behalf. Or they can use a mobile app. And I mentioned that before, to store tokens. We said that, they would get one token per medication. So they can actually have a mobile that stores a token. Or coming soon, they'll be able to register for an active script list. So what is an active script list? We know that a patient may want their electronic prescriptions in a more consolidated list so that they can be more easily managed. Now, the active script list is a list of all active prescriptions and repeats available to be dispensed. And what it does is it removes the need for the patient to receive their token via SMS or email, and then for them to retain that token. So what happens is the patient attends their preferred pharmacy. So they go to their pharmacy before they attend the doctor and request to be registered for this active script list. The patient then needs to, they accept like terms and condition and agree that all prescriptions will go to the active script list. But of course, they can always withdraw their consent. Now, the patient attends the doctor and just as normal, and then gets the prescription that they require. And then that prescription is then sent to the active script list. And what that means is the patient does not need a token, but if they want to receive one, they most certainly can. Then the patient goes back to that preferred pharmacy and the pharmacy validates their identity as per normal processes and dispense medication as normal. Now, if there are repeats, just like the other token, the token gets sent to their active script list, and it will just depend. So if they have a token, it will get sent to them via SMS or email. But if they have the active script list, it will be sent to the active script list. Now, I mentioned before a little bit about consent, but a pharmacy must gain consent before being able to access the active script list. And that's the same as for a medical practice as well. You must get consent before being able to access that. Now, a person must confirm their identity in order to have a medicine dispensed from that script list. And of course, the active script list doesn't show complete contents of the prescription. It really just shows that individual information so that it can be identified. So this is to ensure that a dispenser is not able to use the details incorrectly and dispense a prescription without downloading that information from the prescription delivery service. So it sits in that prescription delivery service. They scan it and it downloads the prescription into their dispensing software. Now, you will have heard about electronic prescriptions. Now, that's a paper, that paper form. So now when it printed the barcode on the prescription, you'll know that's what was happening before. That may still be visible in the active script list, but the difference is in the active script list, when it's done by electronic prescription, the pharmacy will be able to download that into the dispensing software. If it is an electronic transfer of prescription, so the patient actually has the prescription, is a legal form. Often when that barcode, sometimes something happens or the pharmacy, the scanner doesn't work or for whatever reason, but they can still use that paper prescription to enter the details and dispense the medication, which means that that content of the electronic transfer of prescription still remains, and you'll see that in the active script list. So that will be what that's there. And once that prescription expires, it will disappear out of there. So sometimes if you do hear that if a patient says, oh, but I've got all this other information in my active script list, that will be the reason why. So these are some examples of apps that support storage of tokens. Now, tokens can be added to this app, and they simply click on the link received by SMS or email, and they add to their script wallet in the app. Now, this is really just one example, and there are going to definitely be other apps that will be available. So I just thought we'd go also through some questions that come up. Now, these are common questions. And the first one is, with the token, the token model, what happens if the patient deletes the token? And we know how easy it could be for the patient to delete an SMS or even an email. So what the patient should do is, if the email, they could probably get it from deleted items, but for whatever reason they can't, the patient should call the practice in the first instance and advise the receptionist. Now, the receptionist, depending on what the process is for your practices, they'll send a note, and I recommend that they link that note to the patient's detail and request the doctor to resend that token. And also at that point, the receptionist should really check to make sure that all the details have been updated. We know how easy it is if you say to your patient, is this your number? They go, yeah. So it's really important for them to tell you their mobile numbers just to make sure, and also to verify their email address. Now, really, before the patient finishes the consult, so if it's in the first instance of receiving that token, they should be checking with the doctor. The doctor should be checking with them that they've actually received that token. It's almost instantaneous. Now, the second one is, we know that people can sometimes change numbers or the email address isn't correct. And I sort of touched on that a bit now. So what happens if that token gets sent to the wrong number or email? Now, the prescriber should ensure the token is received, as I said, at the time of consultation. However, if it does still get sent in error, that prescriber, like I showed you before, can cancel that prescription and generate a new token. So if anyone has received that token in error, it'll show the QR code, and then once it's deleted, it disappears from their phone. Even if it does still show, if they've got a screen capture or whatever, it will come up with that message that that script has been cancelled by the prescriber. And finally, what are the options if a patient is unable to receive an electronic script token? And for example, if they don't have a smartphone. Now, the patient can also provide, and I mentioned this before, that their carer's contact details, so they can receive that on behalf of their of the patient, or they can still have a paper prescription. And it's really important to recognise that if they don't have the smartphone and they don't really want to have an electronic prescription, they really should then have a paper prescription. And I mentioned before at the start of the session today that if they have a paper prescription, they cannot change halfway through and have an electronic prescription. They can get a new prescription with a new token, but they cannot get they can't change over halfway. And the same for if they have an electronic prescription. So they've got the token, they've received it on their phone, and they go, oh, I don't like this. Then they can't just go, oh, no, I want a paper prescription instead. They could have that printed copy that we saw before that doesn't have, it's just a plain piece of paper, but they cannot get it transferred into a prescription as such. Anyway, I hope that's answered some of those questions that you might commonly come up with. Now, there are some communication resources out there specifically targeted for pharmacies and general practices. And, there is all different ranges. So from, we're getting ready, we are electronic prescription ready, so that patients know that you've actually got that functionality available. Now, to get some of these print resources, so you can get window stickers, you can get counter cards, you can get brochures, and there's also some digital assets, and that's so you can do Facebook advertising and even web banners. Now, in order to get these, you just need to contact your local primary health network, and they will be able to order those for you, and they are completely free. So the delivery doesn't cost anything and the product doesn't cost anything. Now, on the screen here, we've got a list of technical requirements that, puts you in the right place to get your practice ready, to make sure that you're ready for electronic prescriptions. Now, there's quite a few different ones here. So first of all, you need to have a HPIO. So you need to have your organisation registered. You need to have a NASH or Medicare PKI site certificate, because that's what's required to access the healthcare identifiers service. And also you need to be able to search for a patient's individual healthcare identifier. So that's part of that registration for your NASH, so that you can connect to the healthcare services. And the other one you need to be connected to is a prescription delivery service. And I mentioned before ERX or MediSecure. You might already be connected. So if you're already printing barcodes on your prescriptions, then you already are registered for electronic prescriptions, as in the connected to the prescription delivery service, because without that, you cannot participate in electronic prescriptions. And then the next one is you need to install the upgraded software, and that's to ensure that you've got the relevant healthcare identifiers. You need to make sure the HPIIs, so that's the APRA numbers are registered in your software, and that's for every general practice or nurse practitioner, anyone who does prescribing within your organisation. And also the HPIO, which is your organisation, is recorded. So you need to make sure all that information's there, and importantly, upgrade your software. Now, I just want to duck back to the prescription delivery service. What I want to say is really important for any of the prescribers in your practices to make sure that their prescriber details and provider details are registered with that prescription delivery service. Without that, obviously they're not connected to it in some way. Even though the practice could be connected, they each have to be represented. And then again, most practice managers do this, I guess, but then if you are aware of that as nurses, then just let the practice manager know or the doctor know that they have got to contact the prescription delivery service to make sure they're registered. And then, and I've mentioned before about making sure that the patients, they're familiar with what you do. Make sure that reception staff are validating those IHIs. So if you have a patient come out to you in your treatment rooms, or if you've got a patient that you regularly see and you can't access something, just make sure that validated the IHI, so that can be, you can send the electronic prescription. So stay up to date with relevant state and territory legislation. Really important to discuss some workflow within the organisation and how it all works, so that you each know what the role is. It's not all up to nurses to do everything, so everyone needs to play a part in educating. And really, I think reception is the perfect place to alert patients to the fact that you do electronic prescriptions. So I think that's a really good starting point. It's also another thing to do is have a conversation with your local pharmacy, just to make sure that they are ready for electronic prescriptions. Because if the patient gets a token and the pharmacy can't dispense it, they cannot get that prescription. They need to come back to the doctor's surgery to get a paper prescription. So it's really a good idea just to keep in contact with that local pharmacy, or even check with your patients. So some of the patients might say to their pharmacy, I know I asked mine, are you ready for electronic prescriptions? Because I'm dying to try the token out myself. So, it's a good idea to have that conversation with the patient as well, because while they're waiting, they could possibly ring and just check that for you. We've also got heaps of information on the Australian Digital Health Agency website. So these are our resources, and some fantastic fact sheets. These e-learning modules are absolutely great too. You'll find heaps of information in there. And as I said before, contact your local PHN to get a copy of any of the communication materials that you may need. All right, so we are up to the question part of the session. Marg, has Jihan joined us?
Yes, hello there. Yes, we do have Jihan on the line now as well. So I didn't introduce Jihan at the start, but Jihan Gerges is a primary healthcare nurse who has worked in a general practice in the southeastern suburbs of Melbourne for 8 years. And so Jihan's going to give a bit of information about her experience, and then there's a couple of questions that are waiting for you, Nikki.
All right, lovely. That's fantastic. So we talked to Jihan before, and Jihan, would you be able to share how you prepared your doctors for the rollout of electronic prescriptions in your practice?
Okay, so hi everyone. Thanks for the question. We have, before the e-health, before the e-script started, we had a staff meeting, and we asked the reception staff to make sure that we have current contact details in terms of mobile number and email address for all of the patients. As well as we've contacted the local pharmacies, and we wanted to make sure that they are ready for the e-script. And then I received some resources from Eastern Melbourne PHN as well as medical director, and hand all of these to the doctors at the time. And
so on that, Jihan, how were you able to make sure that your patients were able to receive the electronic prescriptions? So have you set up a, can you share with the other nurses here, is it good to get your reception staff? Did you ask your reception staff to get set up, or what process did you put in place to help with your patients understanding electronic prescriptions?
When the reception staff started to ask patients about their email, they told them that we will be able to send you electronic prescriptions on the email, and we managed to do that. And also at the time we did not have the latest version of medical director, so we had to get our IT to install that for us before the e-script starts. Very much that's what happened at the time.
That's great. Thank you so much, because it is also really important that, and I mentioned before, that you need to have your software updated. So Jihan, absolutely. Great tip there. Make sure that your software is updated. So if you're looking, you think that you've got everything set up, it's the final piece in your puzzle to make sure. And also make sure that prescription delivery service is also set up too, which is a good tip. Now, Marg, you said you had some questions.
Yeah, so there's a couple of questions in the last few minutes. So I know that you did speak about the apps before. So could you just clarify? The question is, I know some of the pharmacies have apps to store tokens. Are there non-branded or of a particular pharmacy apps to store the tokens?
I'm not really sure of the question. I know that different dispensing softwares have a different process for storing. But actually,
so are there different apps, and do the pharmacies decide on what app is used?
I don't have any idea what the pharmacies do for their part, but there are definitely a few different apps for storage of tokens, and I showed you one example of what a storage of a token would look like. But as far as the active script list is a little bit different to storage of a token as such.
And to answer the question as well from my own personal experience, because in my area I am connected to electronic scripts, and it's been fantastic during COVID. So when I actually connected with my pharmacy, I do have an app on that, and it was the pharmacy, it was set up through there. So maybe it is specific
great
to pharmacies.
And I guess they would be able to choose. There's so many apps out there that does different things. So, and you found that quite easy to use then, Marg?
Yeah, absolutely.
Yeah, great. That's great.
And the next question is, we have had instances of a specific script being cancelled by a GP for various reasons, and then the other medications that were also prescribed on the same day also being cancelled, even though they hadn't been used or dispensed. Any ideas why this may have happened?
Well, it depends on the software that you're using. And so with electronic transfer, with electronic prescriptions, each script is done individually. So you would send each script individually. As I said, there's one token per medicine. So each one would be done separately. So is this with electronic prescriptions, or was this on a whole prescription, a paper prescription? So I guess I probably need to clarify that. If whoever's asked that question, if you could just type back in.
It was with e-scripts.
With electronic prescriptions.
Yeah.
Okay. No, I have no idea why that would have happened. Can you tell me what software were you using? My understanding is every single software, it provides one token per prescription, so per medication. So
best practice.
Yeah, okay. So definitely, I'm not sure why that happened, and I would definitely talk to best practice about that. But each time they prescribe a medication, and I had that terrible example before. So we had Diagesic, and we have Betaloc, and we have Valium, since we've spoken about that. There would be 3 tokens. So one for each one of those medications. So if the prescriber then cancelled that Valium script, it has no impact at all on those other 2 tokens. So I'm not actually sure why that would have happened.
Thank you to Nikki and to Jihan for joining us today. And just like to let you know that to join us for the next session next month on April the 1st, and the topic is COVID vaccine and the role of My Health Record. So although that's on April the 1st, it's definitely no joke. So I hope that you can join us for our next session next month. So thank you, Nikki, and thank you to Jihan for joining us.